Implant scan body fit. In the world of digital dentistry, a perfect final crown is only as good as the data used to create it. The process relays on a critical component, the scan body. The scan body is essentially a digital map maker. It tells the lab exactly where the implant is located in the jaw, at what depth it sits, and, crucially, how it is rotated. If the scan body isn't seated perfectly in the implant fixture, the entire restoration is doomed to fail. The relationship between a scan body and an implant fixture is identical to the relationship between a final abutment and an implant. Most modern implants utilize an internal hex connection. Think of this like a bolt and a socket. It is crucial to understand that every dental implant requires a specific scan body designed for its unique connection. You can use a scan body from the original implant manufacturer or a compatible version from a third-party provider. For instance, when scanning a Zimmer TSV 3.5 implant, you can use the official Zimmer component or a scan body from companies like Arum, DSS, TruAbutment, or NTI. These third-party options allow you to use their specific components, such as stock abutments or pre-milled blanks. Similarly, for a Neodent implant, you could use a Neodent scan body or an Arum version designed for Neodent. Third-party manufacturers offer incredible versatility. For example, Arum produces scan bodies for over 500 different implant brands, providing a wide range of options for digital workflows. As shown in these images, TruAbutment produces scan bodies for a wide variety of systems, including the Zimmer TSV 3.5, Hiossen ET, Mini and Regular, and Straumann, Tissue Level and Regular platform. When communicating with your lab, you must identify both the implant brand/size and the specific scan body brand used. For example, you should inform them, the patient has a Zimmer TSV 3.5 implant, and I used an Arum scan body to scan it. Because each scan body brand requires a specific digital library for accurate design, the best practice is to send a photo of the scan body label along with your prescription. This ensures the lab uses the correct software settings for a perfect fit. Once the lab receives your information, they select the matching file from their digital implant library. As you can see, there is an extensive list of scan body profiles available for every implant type to ensure the custom abutment is designed accurately. Using the digital scan, the lab designs a custom abutment tailored to the patient's specific anatomy and the implant's position. The software works by aligning or matching the digital library file to the 3D scan sent from the dental office. This precise overlap is what allows the software to calculate the exact orientation and depth of the implant, ensuring a perfect fit for the final restoration. As you can see, the software requires a significant amount of specific data to be successful, including the implant size, connection type, and whether the component is engaging for single crowns or non-engaging for bridges. Without the scan body label, it is nearly impossible for a lab designer to guess this information correctly. Providing the exact brand and model ensures the software pulls the right data from the library, preventing costly errors and ensuring the restoration functions perfectly in the patient's mouth. A pre-milled blank is a piece of medical-grade titanium used by a milling machine to create a custom abutment. The critical connection that fits into the implant is already precision milled by the manufacturer. The lab then mills the top portion to support the crown. Choosing the correct blank is vital because the connection must fit the implant perfectly and match the implant's material properties to prevent complications. To provide this level of precision across the industry, Arum offers more than 500 different blanks compatible with nearly every major implant brand. After the milling process is complete, the custom abutment must be separated from the rest of the titanium blank. This is a highly delicate task because the implant connection, the part that sits inside the patient's implant, must remain untouched and perfectly preserved. At New Pars Dental Lab, we dedicate significant time and effort to this finishing stage. To guarantee the highest level of precision, we protect the connection by seating it into a lab analog before finishing the abutment. This ensures that the manufacturer's original tolerances are never compromised, resulting in a perfect fit and long-term stability for the patient. In modern implant dentistry, the choice between a stock abutment and a custom abutment can determine the long-term success and aesthetics of a restoration. While stock abutments are pre-manufactured in standard sizes, custom abutments, like those we craft at New Pars Dental Lab, are engineered specifically for your patient's unique anatomy.